This is for the back. I usually, and I'll show you, but and you can't quite see much, but I usually do the back from turning round, but this is another way of doing the back, and you can actually put your hand at the sacrum and the hand here at the beginning of the shoulder, or at the neck, between the neck and the shoulder, at the end of the neck connection, so the cervical 7. And what you do again, you connect to the system, you connect to what needs to go, and if the person system wants to unwind, this might be used for people that have a lower back pain or a back pain, and that is the most comfortable way that they can actually lie down. Otherwise they can lie down on their back. And so you connect to that. And again, just follow, it's like connect, follow, and let go, and you ask, literally you ask your head or their system to release any tightness, anything that needs to be released. And again, for the sake of today's demonstration, we are just going to release things that are easy to release. It might be a little bit of tightness, it might be a little bit of whatever, really relaxing, aligning. This is also for aligning, for grounding. Somebody that is very ungrounded could benefit from this position, as well as the laying on the back. And this is and again, just observe. I wouldn't close always my eyes when I do, especially with babies and children. Definitely don't close my eyes, because there are movements that we might miss, and a different part of the body. Remember, we're connecting to the entire system, to the body, and something rather than the back is releasing and letting go, and it's okay. It's what the system needs, and it will move whatever it needs to move. So you can't see it, but the shoulder, the fingers, the foot, one foot on the left side is twitching. So anything, any very small movement, just observe and know that that is a big change. And again, we're just asking that we're going to finish now, finish what they need to finish, and be back when you feel there's almost the time to finish. You just say, okay, that's it for now. Just come back to now, and then that's it. And we actually do it in this way. So if you can turn round now, and so I'll show you with the head. And just would you like to look here? So the person also needs to be comfortable. And what I do, obviously, you can connect very much to the. It's either the sacral, but sometimes if it's only the back, it's actually quite good to go from the upper back. For example, if it's the lungs on the back also is actually quite useful. So if you can lift for me, thank you very much. And lift the, yeah. So this is can be for lungs or liver connection. Again, it's at the back, in between the spine. My hand is very lightly. Is that lightly? Yeah. If it's uncomfortable, ask. Yeah. Okay. So that's good. And then again, if there is something that needs unwinding, I usually feel it on my hand. So I will just feel the back just going like this, and then the legs, everything else also does some twitching, some releasing. With babies, for example, quite often I see shaking, the shock, so trembling, and you will see a shaking of their feet and releasing and moving one side or another, or even unwinding itself. And so again, as this is just to show you the position that you can do things as well. The other thing, just as we are here, if you need, again, you know, around the belly, the stomach, or even the heart, if they need a little bit of unwinding, you can either do it from here, and then whatever it moves, just make sure that if you, to be respectful of, for female, and then you can do the position, and then just wait again until that something happen. And the same if it is something here that is stuck, you just put your hand. You can even put a little bit of traction and then in here, because it's quite more flexible, and then everything can move. Right now I'm moving it, but sometimes things move by itself. I've also seen mainly with trauma and shock, when the body itself just really goes into a shock, a trembling, the person is cold and is releasing something from the past, old past, and that's what you need to do, is just allow that shock, that part to let go. And this is, and again, for the sake of this demonstration, we're just asking, we're not connecting too much and too deep, and we're just going to move to another position.